Good evening, dear Medyascope viewers. Welcome to This Week in Turkey. This evening, our guest is human rights defender and chair of the Turkish Medical Association, Professor Şebnem Korur Fincancı. She'll be joining us to speak about the recent measures announced by the government to curb the spread of the virus, as well as vaccination, which is set to begin in December, according to the Ministry of Health. But first, let's take a look at the coronavirus-related developments of the week. The Health Ministry has registered 32,381 more coronavirus infections, including 6,511 symptomatic cases as of December 3. The new symptomatic cases raised the overall patient count to 520,167. The country's death toll rose by 187 to 14,316, according to the ministry, while the Istanbul Metropolitan Municipality reported 232 deaths of an infectious disease for the city alone. President Erdogan has announced that a nationwide curfew will be in effect from 9 p.m. to 5 a.m. during weekdays to slow down the spread of the virus. As for the weekend, the curfew will start at 9 p.m. on Fridays and last until 5 a.m. on Mondays.
Erdogan said that some shops that provide home delivery service, such as grocery shops and butchers, will also be excluded from the weekend restrictions. Citizens above 65 years of age and younger than 20 years of age will not be allowed to use public transportation, he said. Funeral prayers will be performed with a maximum of 30 people, including relatives of the deceased, and weddings will also not exceed this number. Places such as Turkish baths, saunas, massage salons, swimming pools, and amusement parks will also halt activities. The number of people who can enter crowded streets and squares will be limited by local authorities. Taksim's pedestrian Istiklal Avenue is one of the locations where entry has been limited to 7,000 people as part of the preventative measures. Erdogan also announced that everyone will be required to present their individual electronic HES codes to show their infection status, available through a free smartphone app when entering shopping centers. Public health specialist Dr. Nuriye Ortaylı evaluated both the revelation of symptomatic and asymptomatic cases and the effectiveness of these measures to Medyascope. According to Dr. Ortaylı,
the government has finally given the message to the population that the situation is serious. Although we've been discussing the seriousness of the pandemic in Turkey for some time now, many citizens who did not follow the situation closely on a regular basis now have gotten the message that it was not a time to put down our guard, that the levels of infection has increased substantially. When the health authorities make a statement in this regard, it creates a different impact on the people. If you want people to change their attitudes, then you have to let them know the seriousness of the situation. Up until this point, all we've done is blame citizens. We weren't adhering to the basic rules of health communication. So in that sense, taking preventative measures is an important step. On the other hand, the rate of the spread of infection has increased tremendously, well beyond the 30,000 cases that they have declared. First of all, they're still not conducting enough tests. So we have to be aware of the fact that the numbers are higher and that the rate of the spreading is also quite high. So with this situation, are these preventative measures sufficient? In the spring, we already tried weekend curfews. Many academics have conducted research with mathematic models to see which measures would work best, both for the economy as well as the spread rate of the infection. Their studies indicated that instead of having weekend curfews, a full lockdown of 14 days would have diminished the death toll by 40% and the economic loss would have been the same.
The health minister has announced that the COVID-19 vaccine will be applied starting December and that healthcare workers will be prioritized in terms of access to it.
Health Minister Fahrettin Koca had announced last week that Ankara signed a contract to buy 50 million doses of the COVID-19 vaccine from China's Sinovac Biotech. At least 10 million doses of the Chinese vaccine will be delivered in December, Koca said. He said the country was planning to carry out COVID-19 vaccinations in 4 stages. Healthcare workers, people aged 65 and above, disabled people, people who stay in shelters, and those living in crowded places will be vaccinated in the first stage, Koca said. He said those who work in critical jobs and people aged 50 and above having at least one chronic disease will be vaccinated in the second stage. The third stage includes those with at least one chronic disease aged below 50, young adults, and industry and professional workers not mentioned in the first 2 groups, he added. In the fourth and final stage, all individuals other than the first three groups will be vaccinated. Main opposition Republican People's Party MP Murat Emir evaluated the vaccine purchase that the ministry announced to Medyascope. Emir stated, "The world is scrambling to get doses of the available vaccines at the moment. Countries are doing pre-agreements with these companies in order to guarantee the purchase of the required numbers of vaccines for their citizens." According to what the ministry has said, and they have only made statements without providing a detailed briefing to the public, 50 million doses of the Chinese vaccine will be coming to Turkey. However, 50 million doses of the vaccine are not enough for Turkey, as there is a population of 83 million, so the minimum requirement is 150 million doses. Germany and the UK have made pre-agreements with such numbers. Furthermore, this Chinese vaccine has not passed the phase 3 trials, so there are serious doubts as to whether or not the Chinese vaccine will be appropriate for all age groups. With all of this out there, the fact that the Ministry of Health has not been able to make a deal with any other vaccine developing company is a major concern for us.
This evening, our guest is human rights defender and chair of the Turkish Medical Association, Professor Şebnem Korur Fincancı. Hello, Professor Fincancı. Thank you so much for joining us today.
Thank you. I didn't realize that we would just speak in English. Sorry.
So, Professor Fincancı, the Ministry of Health has finally decided to reveal the numbers of asymptomatic cases as well, which rose the daily coronavirus in Turkey from around 6,000 to around the 30,000 numbers. These numbers, which were contested by medical professionals and associations from the outset, are finally out in the open. Yet again, the 30,000 number is again not accurate. You said in a press statement on December 1st that the test figures suggest that the real number is twice as many as what the ministry announces. Why do you think the ministry has decided to reveal these numbers? Do you believe that they're changing their health communication strategies?
It is a long story, of course, a long story, because since the beginning of the pandemic in Turkey, Turkish Medical Association has just asked for the real numbers and the truth, because without the truth, without the true numbers of these cases, it is not possible to plan and to struggle against this pandemic and to build a proper strategy against the pandemic. However, the Ministry of Health had evaded, and every time they found an excuse and tried to just confuse the community with their excuses. However, there were some missing numbers, which just was realized by the community as well. And Turkish Medical Association every time tried to just read that table, the turquoise table, and reveal the truth through the lines in between. So with this, probably Turkish Medical Association revealing the truth, and also some other stakeholders sometimes discussing the numbers of deaths. For example, the mayor of Istanbul had shared the number of deaths, and it was exceeding the number of deaths announced by the Ministry of Health, and there was a just conflict in between the numbers. And also Turkish Medical Association just tried to analyze the numbers of deaths and the excess death cases in Istanbul through these numbers, where we could just reach through the website of the state, although there are some missing statistics on the websites, but we could reach to some of the numbers, for example, death cases in Istanbul in total, and we try to compare the last 5 years before the pandemic with this year's 5 days, the average of 5 days, and it was 100% more than the last 5 years average of the same 5 years. So the 5 days, sorry. So these were all probably a kind of pressure on behalf of the Ministry of Health. And also they realized that without the exact numbers and the situation, the overview of this pandemic in Turkey, public didn't realize the serious level of the pandemic in the country. So they were a bit just relaxed regarding the situation. Then maybe this was also an effect when we consider the situation. And they had to just take some preventive measures and steps, so they would need a realization in the community for this purpose. Of course, unfortunately, all these preventive measures taken in regard of the pandemic is not a reasonable step for just reducing the speed of transmission, unfortunately. And also there is a serious lap when we consider how these steps are taken and how these decisions are announced in the public, because usually all these announcements and regulations are in the name of Ministry of Internal Affairs, and it is not a problem of security, actually, it's a problem of health. So the reasonable way of just announcing and taking the preventive measures and just trying the public to understand the nature of the pandemic should be the responsibility of Ministry of Health. But unfortunately, we have these kind of security measures instead of preventive measures, and we every day read the news about the fines against people who break the rules of Ministry of Internal Affairs. It is not a way of struggle to punish people, but to find some ways of social service to support and to strengthen the understanding of the public in this sense. But we do not choose that way, and we usually have punishments instead of a social support for people who have problems. And also we know that all the manufacturing have to continue according to the government, and then people have to go to work, particularly the workers. So this is a class issue. This pandemic is not only a problem of health, but also, unfortunately, there is a class discrimination in this sense, because the white collar people can stay in their houses and work from the house, while the workers, the blue collar people have to go to work, since the manufacturing process continues all the time, and they have to work in crowded factories, atelier, and they have to travel with public transportation or some transportation provided by the companies, but they are also crowded as well. So this is a way of transmission when we consider the situation. Although we try to protect the elder people according to the government, for example, the elder people about the age of 65, but also if there is no social support in this sense provided by the government, then these elder people have to take care of the children in their grandchildren. They have to take care of them because there is no way for these people to take care of their children, since the schools and all these kindergartens are closed in this period. So when they have the transmission in the factories, in the atelier, in the public transportation, then they carry the virus into the house where the elders are in the house as well. And these houses are too crowded. So we know that the speed of transmission is higher with the crowded closed spaces. So we have to consider all these parameters when we try to have some preventive measures for lowering the speed of transmission. Sorry, there are too many issues that we have to talk, so sometimes I do not just breathe and talk.
No, thank you for both explaining, the fact that the government was finally feeling the pressure of having to reveal some form of the truth to the public because of the work that you've been doing from the outset, as well as the fact that the public has lost acting seriously in the face of the pandemic. So I guess the revelation of the numbers was in relation to that. And you also explained the ineffective measures and why these measures are ineffective. So the government from the outset has had economic concerns rather than the public health in terms of priority of their concerns. Yet there have been several studies that have been made suggesting that a full lockdown for 14 days would have the exact same results in terms of the economic impact instead of having weekend lockdowns. So would at this point a 14-day lockdown be the most urgent measure that needs to be taken?
Yeah, actually, this is urgent, but of course there would be a way of effect, a positive effect, when the government had taken some preventive measures, although they are not sufficient to prevent the pandemic transmission in the country. At least there is a public awareness now regarding the pandemic and how the situation is getting worse in these last few months, so starting from September. So public awareness is also an important part to lower the speed of transmission, because they would not be in closed spaces outside their working time. And also all these cafes, restaurants are closed now, so they can't gather in closed spaces. But we know that the malls, for example, are not closed. And this is another threatening issue regarding the transmission because of the central air conditionings in these closed spaces. But people just start to avoid going such kind of places because they realize about the serious level of the pandemic for the time being. So then this would decrease the transmission, but we know that a total lockdown would be more effective and just would have a much quicker effect on lowering the speed of transmission. So we asked for such kind of a lockdown, not as a way of curfews also, but just limiting, restricting the
Circulation.
People coming together, but instead they have to have an increased physical activity, personal physical activity, while they keep the personal physical distance. So we just try to inform people that they have to demand enough parks and open spaces to have some physical exercise outside instead of being closed in crowded houses. This is also important. Yes, it would be effective to have a 2 weeks lockdown with a complete end of manufacturing other than the urgent manufacturing items, and no public transportation, but having the physical exercise nearby their houses to prevent the obesity also in this sense, because we know that obesity is one of the highest risk factors, a comorbidity for this pandemic. There is a 74% increase among the obese people when they just catch this COVID-19.
Sorry.
So we have to keep in mind that at 14 days, at least 14 days, this is also another issue, because this is one circle of the transmission, 14 days, and preferably 2 circles, 28 days, would be more effective in prevention. And also we have to keep in mind that we have a correct surveillance system, affiliation system to reach to the source of the infection and to isolate these people properly and taking care of them also while isolating, because many of these people would need to be taken care of since they would be with some symptoms of lethargy, fatigue, and wouldn't be able to take care of themselves alone. So there are several steps that have to be taken. Of course, there are missing steps. Most of them are missed regarding the government's perception, unfortunately. And we know that which is their priority, because they already confess that this is a national interest, not a
public health issue.
Of health. Yeah. A national interest or the economic issue. They didn't openly said the economy, but they said national interest, which is economy hidden under these lines.
Professor, I'd also like to ask you about the vaccine, but before we come to that, this 14-day lockdown, minimal 14-day lockdown would be also effective in alleviating the pressures that there are on the health system as well, on doctors that have been working relentlessly. Now you're in contact with doctors across the country. We've read reports about, emergency units being at full capacity. We've been hearing about the increasing number of deaths by medical personnel who have been treating such patients. What else can you tell us about the situation in the hospitals and what the doctors are going through?
again, because of the health policy of the government for many, many years, now we just came across with the pandemic in the hospitals. This is not a way of just meeting the pandemic. We have to just start working regarding the preventive health services, the primary care units, instead of the hospitals. But since we met with the pandemic in the hospitals and in emergency services, for 9 months, we just meet with the pandemic and with the cases at the emergency services. There is no emergency with a 9 months long pandemic. So the emergency services are full with the COVID-19 cases, while people who need some emergency healthcare cannot have access to emergency services in the country. And we have also had a report about the excess staff cases, which indicates that people are unfortunately killed because of other health problems, since they don't have an access to that healthcare system. For so many COVID-19 cases are just stuck in the emergency services, in other services, and many of these services for other health problems are just shifted to COVID-19 services because there were too many cases. And the intensive care units are a totally devastating issue, because we know that there are no beds for intensive care units. So they have some kind of intensive care beds in the emergency services, in the corridors of some services in between, but there is no sufficient number of personnel to take care of these people, and there is no proper machines or other kind of instruments to build a proper intensive care unit. Although the government just announces that the 70% of the intensive care unit beds are full, we know that they are all full regarding the announcement of intensive care physicians association presidents. So this is not reasonable, and also the physicians, all health workers are devastated during this pandemic. They are getting ill and they can't work, and many of our colleagues are dead throughout this period. It is now more than 200 health workers and physicians dead in this process. Just yesterday, we had 5 health professionals who died in one day. So in order to just take this burden over their shoulders, we have to have preventive measures, and the total lockdown also would make their work easier in this sense.
Yeah. Well, now there's been this week, Health Minister Koca has revealed that there was they had ordered 50 million dosages of the Chinese vaccine Sinovac. The vaccine hasn't completed its phase 3 trials, and also 50 million dosages would not nearly be enough for a population of 83 million, which is the case in Turkey. I know you have had many questions asked to you in this regard, and that the Turkish Medical Association is currently working with specialized organizations on the matter. But what can you tell us about this vaccine and the expected vaccination plan the ministry has revealed?
It is a pity that we do not trust our government. That's a problem in Turkey. we never trust, because they easily lie about the situation. They easily lie about some scientific measures. But we have to know that vaccination is a life-saving step regarding all kind of diseases and these kind of pandemics particularly. So the public should know that vaccination is life-saving. But we have to keep in mind that all these scientific research and the steps taken should be shared openly. So the government should be transparent about the results of their scientific research, all these steps taken regarding the research, phase 1, 2, and 3. What are the results? What are the, of course, the effects and the negative effects and the positive effects of all these research? It is just essential for life-saving. Then public can easily trust the government regarding all these transparent information and be more confident to seek for vaccination. But Turkish Medical Association, as you have mentioned, now works with all these professional specialty boards to ask the proper questions to the Ministry of Health so that they can be transparent. So again, our role is forcing the government to be transparent in this sense. It is the most important issue of Turkish Medical Association, the most important responsibility to force the government for transparency. From the beginning of the pandemic, Turkish Medical Association tried to fulfill this responsibility, trying to force the government to seek for transparency and inform the public also, and raise awareness that they have to ask these same questions to the government, because they have the rights of citizens to ask these questions and seek the truth in this sense. But we have to keep in mind, vaccination is essential, life-saving. So we have to ask the proper questions. The government should just explain all these steps taken, and vaccination is a public health issue, so should be without any price, free of payments. It should be just distributed fairly among all the citizens, starting from the risk groups, of course.
Yeah, and as you said, the transparency, if the health officials were transparent and were able to gain the trust of the public, this would also go ahead in preventing such conspiracy theories in relation to the vaccine, which have been quite common these days. Yeah.
Exactly.
Yeah. Professor Şebnem Korur Fincancı, thank you so much for having joined us today.
I thank you for just giving us a voice for the public.
It's a privilege. Thank you.
Online news portal Oda TV claimed on December 1st that a group of ISIS militants had been caught plotting an assassination attempt against Istanbul Metropolitan Mayor Ekrem İmamoğlu. Interior Minister Süleyman Soylu refuted the report.
Shortly after the report came out, the Turkish police released a statement denying that an assassination attempt was in place. It also refuted claims that the assassins were apprehended. From time to time, we receive such unverified information against public officials, statespeople, individuals under protection, institutions, or places that can create sensation due to their duties, the statement read, adding that such notices are shared with the relevant people and the necessary measures are then taken. Istanbul Municipality spokesperson Murat Ongun said that they received information on November 23 about a threat against İmamoğlu's safety following intelligence on a terror organization. Within the framework of this information, the existing precautions have been maintained and sensitivity has been increased, Ongun said, adding that they have not been notified about the capture of any suspect in relation to the incident. On December 2nd, Interior Minister Süleyman Soylu refuted the reports of such an assassination attempt. Such an assassination attempt is out of question, Soylu told reporters at the Turkish parliament. Anyone caught in such an assassination attempt is also out of the question, Soylu added, citing police statements which he said contained all the necessary details on the issue.
The Istanbul Metropolitan Municipality has issued a $580 million senior unsecured bond to finance 4 metro line projects. Issued with a 5-year maturity, the bonds are priced with a final yield of 6.6% and have a coupon of 6.375%. The deal was completed following 2 days of conference calls with global investors and attracted a $2.5 billion of orders.
The transaction breaks new ground as it marks the first ever local government issuance out of Turkey in 30 years, the largest USD deal achieved by a city from the Central and Eastern Europe, Middle East and Africa (CEE-MEA) region, and the first municipal issuance out of CEE-MEA since 2013. The proceeds of the transaction will be used to finance the following metro lines in Istanbul: Kaynarca Pendik Tuzla, Çekmeköy Sancaktepe Sultanbeyli, Kirazlı Halkalı, Mahmut Bey Bahçeşehir Esenyurt. In a move to ease the city's traffic congestion problem, the new metro lines will introduce 39 new stations and an additional 52.1 kilometers to Istanbul's metro railway system while serving 275,000 passengers hourly. Speaking on the matter, Istanbul Mayor Ekrem İmamoğlu said, "The high level of interest shown by investors to the bonds issued by the IMM is a product of the widespread trust in Istanbul's new administration. The reliable investment climate created by the IMM's commitment to the principles of transparency, merit and collective thinking is what kept the coupon interests at the minimum rate of 6.37%. The diligent efforts of Deputy Secretary General Mr. Turgut Tuncay Önbilgin and his team were central in the run-up to the IMM's historic Eurobond deal. The Deputy Secretary General said, "Winning over international investors is possible only through a climate of trust. We were able to convince the investors who had previously distanced themselves from Turkey of Istanbul's strength, reliability and cooperativeness."
The Turkey Wealth Fund said on Monday that it sold 10% of its shares in Borsa Istanbul to the Qatar Investment Authority for $200 million, finalizing a deal signed last week.
The agreement of the sale was signed by Zafer Sönmez, CEO of the Turkish Wealth Fund, and Mansur bin Ibrahim Al Mahmoud, CEO of the Qatar Investment Authority, at the Presidential Palace in Ankara. The Turkey Wealth Fund, established in 2016, holds all or part of the shares of several Turkish companies, including flag carrier Turkish Airlines, telecommunications giant Türk Telekom, state lenders Ziraat Bankası and Halkbank, and oil company Turkish Petroleum. Furthermore, the fund is the majority shareholder of the country's sole stock exchange. It said in a statement that it will still retain 80.6% of shares in Borsa Istanbul. The transaction implies a total equity value of $2 billion for Borsa Istanbul, it said. The Qatar Investment Authority is the sovereign wealth fund of the Gulf state.
Turkey's economy has grown 6.7% in the third quarter of this year, thanks to a combination of interest rate cuts, government spending, and a government-led push for banks to lend.
Turkey's coronavirus-battered economy fared far better than all peers in the third quarter, driven by a stimulus campaign that sacrificed the lira and price stability. Gross domestic product last quarter rose 6.7% from a year earlier, after shrinking 9.9% in the previous 3 months, according to the data released on Monday. Moreover, the inflation rates for November 2020 were also revealed. According to the data provided by the Turkish Statistical Institute, Turkey posted a 14.03% annual hike in consumer prices in November. The annual inflation rate rose 2.14 percentage points in the month, up from 11.89% in October. The highest annual price hikes were seen in miscellaneous goods and services, food and non-alcoholic beverages, and transportation with 29.42%, 21.08%, and 18.67%, respectively. On the other hand, low annual increases were seen in clothing and footwear, communication, and education, with 0.99%, 5.19%, and 7%, respectively.
That's all from This Week in Turkey. See you next Friday at 9 p.m. Good night.